I often get a question from doctors: what makes a dental practice succeed and what makes them fail? And what is it that I see with coaching clients who have successful or failing dental practices, and what's a common theme? So let's talk about this. So first, let's talk about dental practices that do really, really well, and what is it that these doctors who own these practices do well that makes them succeed. So doctors who do well, they usually start out by hiring really good people before they even buy or start their dental practices. So they hire attorneys that help them set up a business. They also hire dental CPAs who specialize in working with dentists to set up the business and get everything squared away. They also hire coaching and mentoring help. So for example, for HR help, because it's very difficult to navigate the human resources and employee laws, so they hire help for that. They also hire coaches that help them train their team, as well as to build a team, as well as these people also going to help them build a team that's going to get the practice up and running. So basically they hire very good coaches, because you can't go to the Olympics without any coaching help. So you need to hire good people that have your best interest, and they coach you and they train you. Now, number two is that they learn how to market, and they have to market a lot and how to market well. Or if they don't know how to do it, they just simply hire somebody who's going to help them put a good marketing plan together. Because if people don't know that you even exist, and I have coaching clients who have practices that are not known at all for the general population, so customers don't even know that the practice even exists. So you need to have marketing, and you need to market a lot. Just because you're a good dentist, you're a good clinician, you're a nice guy, doesn't mean that you're going to succeed. Matter of fact, most of the failed practices that I see are super nice doctors who have great clinical skills, and they're wonderful to work with, and they're failing because they simply didn't do very well with marketing. And there might be other issues too, but usually it comes down to just not enough work. Now, the next one is not something you can teach, although you can guide somebody for this, which is having a positive mindset. It is essential that you have a positive mindset if you're going to run any kinds of successful business. Just look at all the successful people, and I guarantee you that they all have very positive mindset. This is the number one problem with struggling practices. Usually what happens, the business starts struggling and the doctor loses their positive mindset, and they develop kind of like this negative, cynical outlook. And it's very difficult to help those doctors at that point. So it's very important that you safeguard your positive mindset. This is why I tell doctors, don't worry about politics. Don't watch the stupid news. It's not going to help you. It's not going to be any good, because if you watch the news, then you'll be misinformed. If you don't watch the news, then you'll be uninformed. So you have to pick your poison. I'm okay not watching the news, and I'm okay with that. So, but I kind of like to maintain my positive outlook. So you hang out with positive people, look at positive things, post positive things, and just all positive stuff, because otherwise it's going to be very difficult to build a successful business. So maintain your positive outlook at all costs. Now, the other thing that these doctors also do is they get really good at big business management. They either take courses to get good at that, and they do that before they even start a business, or like I said, they hire mentors and coaches who can help them with that. There's a lot of good books, there's study clubs, which brings up another point, that a lot of these doctors also network really, really well. So they have a personality that's kind of likable, it's easy to get along with. And it just makes networking all that much easier, because you don't need to reinvent the wheel. You can learn a lot of the things that you need for running a successful business just from other people who are doing it. The other thing that these doctors often have is good relationships, both professionally and romantically, as well as good relationships just overall with their colleagues, as well as with the employees. And also, they don't hire staff, they build a team. There's a difference, there's a huge difference. So and you have to make sure that your team balances out your personality. So for example, if you're an introvert, you need to hire team members that balance it out, because if you hire people just like you, you're going to have a team of introverts and nobody's going to be talking to anybody, and at lunch break people will be just sitting in their cars, just watching TikToks or whatever, or reading books, and nobody will be communicating and talking. If you're an extrovert and you hire a bunch of extroverts, then you're going to have a basket full of conflicts all day, every day, and people will be talking on top of each other. So one thing that you can do is take the Myers-Briggs test. That's going to tell you your basic personality, and then you want to balance it out with your team. So if you're an introvert, you get some people who are a little bit more extrovert. It may be exhausting because you're not used to all those people talking so much, and they're very extrovert, and it is very tiring if you're an introvert, but you need to balance out your personality. And here is the biggest one, and this makes the biggest difference. It's not just that these doctors just market, but they set up practices in areas that need their dentistry and their help at most. So they set up practices in underserved areas with less providers, so not too many dentists. One of the biggest mistakes doctors do, they set up practices in these super urban areas that's very fancy, it's high middle class, nobody needs any dentistry, and there are 10,000 dentists in a square mile area. So it's very important that you set up a practice where your services are actually needed. It's very difficult to sell ice cream to Eskimos, so it's easier to sell ice cream, in Florida. So it's kind of like the same idea. You want to go to a place where your services are needed and there are not too many providers. Now, there's also a big misconception that underserved areas are only in rural areas, and that is not true. There's a lot of urban underserved areas. Some areas in a city are very blue collar and very underserved or lower middle class, and there are just not too many dentists there. In general, any city that has a dental school are going to have a lot of dentists, because dentists tend to hang out in a city where they graduated from. So if you're in a city where where there's a dental school, you're gonna have a lot of dentists. So it's better to go to areas where there is no dental school, because you're gonna have a lot less dentists in general. So these are all the things that doctors who do really well do, and there are some other things. They get very involved in the social settings, they're very involved with social social media, they post a lot, they're just, they kind of have a magnetic personality, and they're very involved in the community. They do school visits, they involved in Rotary Club, and all those kind of local things that it takes. And you go to maybe they coach soccer. They're just very involved in the community, because as a dentist, you're kind of a member of a community. You need to have patients who come to you, and you cannot be shy. So you always have to be also asking patients for referrals, and asking people to send their friends and families to your practice. So you cannot be shy. So that's very important too. So these were all the examples of what do dentists do who are very successful. Now, if you want to look at what do dentists do who struggle, in my experience, and I do see, unfortunately, several practices that don't do very well, they just simply do the opposite of all this. They don't hire help before they start. They simply buy very expensive equipment without consideration of how much it's really costing them. They take out these huge loans. A lot of times they have a difficult time networking. They also don't have very good help. They don't hire dental CPAs, they don't hire coaches, they don't hire consultants, they don't have mentors. Oftentimes their personality, they don't match their team. So for example, they might be really introvert and the staff is very introvert. So it's just a very, very slow communication at the practice, or they're very extrovert and the staff is very extrovert, so there's a lot of conflicts. So that's another issue. And first and foremost, they go to areas that simply do not need more dentists. There's a lot of dentists there, and the area might be high middle class or middle class, where patients just simply don't need a lot of dentistry. And that's just the fact of life, and it's going to be very difficult to find work in an area where there is no work and a lot of people providing services already. So these are all very, very common mistakes. The other huge mistakes a lot of people who struggle, a lot of dentists who struggle make too, they don't do marketing, or they don't do marketing that's effective. And they just simply waiting for patients to show up, and patients are not going to show up. You got to do marketing. You have to ask patients for referrals, and you just really have to get out there and network and meet people and get to know people, as well as ask for their referrals, get involved in the community. And when the practice is struggling, just hire help and turn that ship around. Don't just be moping around how slow the office is and get on social media and watch all the negative comments, how bad the economy is. Turn that off, ignore it, and maintain your positive mindset. So if you want to turn this around, make sure you get help. We have study clubs once a month for doctors how to build a thriving dental practice. Just come and join that. And we have Q&A sessions, question and answers. So we can help you with that too. And we can help you build, a thriving dental practice that's going to do really, really well. But first and foremost, at all costs, make sure that you maintain a positive mindset, because it's going to be very difficult to do anything if you lose that. So hopefully this helps. I'm Dr. Nagy. I do coaching and mentoring for doctors to build a thriving dental practice, as well as I teach orthodontics so you can take your practice to the next level. Have a good day.